it was a forced marriage. We had 2 mental health facilities, 2 addiction facilities, 2 academic, 2 clinical. They focused on different kinds of problems.
It was exciting but scary as well. Nobody really understood how addictions and mental health were going to work together. So there was a lot of fear and curiosity. There was a lot of discussion about what our name is going to be. So we all think of the Center for Addiction and Mental Health now and how natural that sounds, but back then it was a big question for everybody.
There was a sense of I don't want to say unease, but just apprehension.
Certainly lots of concerns around is how's my work going to change? How is the work that we're going to be offering clients change?
We had about 3,000 patients total, inpatients and outpatients, about 500 inpatients. And overnight, we went to 23,000 patients with the addictions patients coming in. We're actually told to keep it quiet that we had a dental service because we wouldn't be getting any more resources.
And frankly, we had bumps. How you deal with the Queen Street community, for example. How you do the best in community relations. And there weren't always easy mornings on the radio. They weren't all upbeat. So I found the fear, the sense of loss, but then the aspiration highly motivating and unifying. We wanted to make mental health and addiction on a par with all other types of human pain and suffering. Everybody could buy into that.
When I was practicing as a social worker in the emergency department, starting in 1992, if we saw somebody who came in who had a mental health problem and an addiction, we would quite routinely say to people, you go next door to the Addiction Research Foundation and get help with your addiction, and when you've got that figured out, then you come back to us and we'll talk about mental health problems and get you into treatment there. We are thankfully not at that place anymore. We now embrace the notion of complexity and concurrent disorders.
Depending if you worked in the mental health side or in the addiction side, our quote diagnoses or the way we would engage that client was very different. So someone presenting with particular issues in the child, youth and family side may have thought, oh, that's anxiety. And on the addiction side, it may have been induced by a particular drug or alcohol. So I think that was kind of the eye-opener about how important and imperative it was to actually have this arranged marriage, so to speak.
I've seen so much change over 20 years. I think about the use of email and how that was just beginning. I think about manual documentation and where we are with electronic patient documentation. I think about little pink slips that we started out sending messages with, and now having, you know, little sticky notes, even electronic sticky notes. So for me, there's been very much a transformation of the times and the transformation of care, transformation of the organization.
20 years back, everything, like you just walk into Camh and oh God, you know, on the floors. But now, look at the difference, eh? It is so wonderful. Like new buildings, new gym for the patients, a lot of programs, a lot of things that they have done for the patient, which is so wonderful.
I'm very proud of the number of clients that we have supported and helped over the years, that we were able to offer, you know, clients access to psychiatrists and addiction doctors and nurse practitioners, and having, you know, a holistic way of healing that's been, I think, really beneficial for our clients.
I am so proud to see these patients, you know, being able to get better, recover from their illnesses, and be perfectly transformed, you know, to go back to the society and be back with their families.
The proudest. In the last number of years, our ability our desire to pull in people with lived experience to work with us as teachers, as people who can give us sage advice.
What I'm probably the most proud of is just the breadth of knowledge in the organization and just the level of deep care about the work that we do. I often say that the value of CAMH is really the people that work here.
We've come a long way in 20 years. I think back to 2009, which was the first time we actually had a donor name on one of our buildings, and to see us have come such a long distance in getting a $100 million donation just a few weeks ago, that was just unbelievable. CAMH has become a household name in a very different way than I could possibly have imagined, and it's really somewhere that I'm proud to say that I work at.
I'm so proud of you. I'm so proud. Anybody can come up with an idea. Making it work takes everybody pulling in the same direction. Wonderful, beautifully done.